Hello guys and welcome back to my channel. In today's video we'll be talking about morning sickness. So in this video I'll be explaining what morning sickness is, the cause of morning sickness, the risk factors, and also how you can manage morning sickness. If this is the kind of topic that interests you, please stay glued. Remember, in this channel we talk about fertility, women's health, and everything health. And if you're seeing me for the first time, my name is Peace and I'm a registered nurse currently practicing with NHS in England. If you enjoy this kind of content, please do not forget to give me a like and subscribe to my channel. So let's get started. So morning sickness is simply a series of symptoms that pregnant women experience, especially in the first trimester of pregnancy. Well, it is also important that you know that when we talk about morning sickness, it's not necessarily something that occurs in the morning, just as the name implies. Well, in some women, they experience it at different times of the day. It could be in the morning, evening, or at night. It can be any time in the day, although it is called morning sickness. So it comes with a variety of symptoms, but most women always complain about having this nausea, vomiting, heartburn, and the rest of them. So in this video, I will be explaining to you exactly how you can manage it. It is also important that you know that it is normal for a lot of women who are pregnant to experience morning sickness. In fact, about 70 to 80% of pregnant women experience morning sickness. So it is not something to be worried about. And also know that it is something that does not harm your baby, except in very severe circumstances where it can lead to low birth weight. But generally speaking, it's nothing to be worried about, both for the mom and for the unborn child. So let's go straight into it. Now, when we talk about morning sickness, there is no exact cause of morning sickness. However, there are what we call predisposing factors or risk factors. So I'll be sharing a couple of these risk factors to just let you know what can, put you at risk of having morning sickness. Well, before I begin to talk about these risk factors, it's important that we know about when this morning sickness begins. Mostly between the 4th to the 5th week of pregnancy, a lot of women begin to experience the symptoms of morning sickness. So these symptoms persist and it even gets to its peak around the 9th week. And also, it is expected by the end of the first trimester, these symptoms should, reduce or even stop. But unfortunately, for some women, it can, get into the second trimester and even to the third trimester. So it can be really difficult for a lot of women in this situation, such that throughout the pregnancy, they are experiencing these symptoms, which can be really, really difficult. So let's now talk about these risk factors. As I mentioned earlier, these risk factors simply means those factors that can put you at risk of morning sickness. It doesn't necessarily mean that if you have any of these, it's going to make you have morning sickness. So let's begin. The very first one is genetics. And in this one, we are talking about if, for instance, your mom or your sister have experienced morning sickness when they were pregnant, it's also likely that you will experience it. The second one is when you have twin or triplets, that's multiple pregnancy. So if you have multiple pregnancy, it also increases your chances of experiencing morning sickness compared to someone with a single pregnancy. But in most cases, we also see that people who are not having multiples, who just have one fetus, they also experience morning sickness. Next is having a BMI of greater than 30. So BMI simply means your body mass index. So this body mass index tells us whether you are obese or you are overweight or you are underweight or you have a normal weight. So the regular or the normal healthy BMI is between 18.5 to 24.9. So from 25 till 29.9 is considered as overweight. But when it hits 30, then we can say the person is obese. So in this situation, if you are obese, your BMI is greater than 30. So it also puts you at risk of having morning sickness. I hope this makes sense to you. The next factor is if you usually have nausea when taking estrogen-containing oral contraceptive pills. Most women, before they got pregnant, probably they were on oral contraceptive pills which contained estrogen. For some women, they experience nausea while taking this medication. So for such women, it is very likely that you will also experience morning sickness. This is because during pregnancy, there is, an increase in hormones like estrogen and progesterone. So this means that you will also be experiencing morning sickness. And the final 2 points are when you've had morning sickness in your previous pregnancy, or you have a history of motion sickness or migraines. All of these are the risk factors, are the things that can predispose you to having morning sickness. So this is not to scare you, but to help you have the knowledge of what could be causing these symptoms you're feeling at this time. So, as I mentioned earlier, remember that morning sickness isn't necessarily a bad thing, and it happens in almost, in a majority of pregnancies. So, it's nothing to be worried about. However, if you feel your symptoms are so severe and you can't manage it, it's really advised that you get in contact with your doctor or midwife to seek some medical advice. Now, to the most important part of it, how do you manage morning sickness, or what are the treatments of morning sickness, as a lot of people call it? Now, when we talk about the treatment of morning sickness, it simply means the various things you can do to help prevent those, symptoms from coming up, or to reduce the symptoms. So one of them is lifestyle modification. And here we are talking about trying to avoid those things that trigger your symptoms. Now, one of the things you can do is to avoid triggers. So things like smells that make you feel nauseous, smells that make you uncomfortable, try to avoid them. They could include perfumes, they could include even the smell of certain food that you used to like, and now they are really, uncomfortable for you. So it's very, very important that you avoid these kind of smells. Then another one involves, making sure that the kind of diet you eat is something that wouldn't trigger, these symptoms. So ensure to eat food that is high in protein and carbohydrates, and avoid food that are high in fats, because this can also trigger the symptoms of nausea. Just as I mentioned earlier about some scents that can put you off or make you feel nausea, it's also been found that some certain smells can also make you feel, happy and comfortable. So things like the smell of lemon, ginger, and some other things, it depends on you, those smells that are okay with you. Some people even carry them around and, try to sniff them, and that, really keeps them comfortable. So whatever, that works for you, just try and do it, as long as it doesn't put you, at risk, or put your baby at risk. So another thing is ensuring that you stay hydrated at all times. This also helps to improve your symptoms. Still talking about the lifestyle modifications, another thing is the kind of drinks you take. Kind of drinks that have a kind of sour taste, like ginger taste or lemonade, all of those drinks can really help you. Personally, these are the kind of drinks that I take in my first trimester, and it really helps me to manage the symptoms of nausea. Then the next one is sipping water rather than drinking it with a cup. Personally, I also find this to be really helpful. I don't know how it works, but a lot of women has also confirmed that this really helps them, because at this point, it is very important that you stay hydrated. Sometimes you don't feel like drinking because of how you feel, the taste you get in your mouth when you drink, but sipping it in little amount really makes a lot of difference. The next thing you can do to help you at this point is avoiding bad eating habits. Bad eating habits involves lying down immediately after you finish eating. If you're a pregnant woman, this is not helpful at all for you. This is because during pregnancy, the presence of progesterone in your body, it relaxes the esophagus, and this makes it, very, very easy for the food you eat to easily, come back into your mouth by the time you lie down. I don't know if this makes sense. So this is what you really experience as heartburn. So because the esophagus is, a bit relaxed, kind of open, when you lie down, you see and you feel like the food is coming up into your mouth. So this is one thing you can do to prevent heartburn. Then the next thing is you can seek for counseling, especially if this morning sickness comes with some form of anxiety. A lot of women has benefited from counseling, and this can really help. It depends on the kind of symptoms you are having. Then next is acupuncture. It has been found that the use of some acupuncture, special acupuncture bracelets, or using your fingers to press in some certain parts of your wrist can help to relieve the symptoms of nausea. But this does not really work for everyone. The next point is taking your medications as prescribed. Some medications such as iron tablet can cause stomach upset when taken on empty stomach. So it is very important that you take medications like iron after eating or just before having your meal. Finally, the use of medication in the management of morning sickness is something that is also advised. So if you feel that what I've just mentioned earlier does not work for you, it's very important that you get in contact with your doctor, as you might be given some prescription medication like vitamin B6, doxylamine, and even antihistamine. So for antihistamine, if your morning sickness is associated with motion sickness, you can have antihistamine, as they can help with that. But it's also important to know that when taking antihistamine, one major side effect is that it can cause drowsiness. So it is not advised that you drive at times when you're taking these antihistamines. So other prescription medications which your doctor might decide to give you are also going to be helpful in this time. So if it's something you cannot manage on your own, please do not hesitate to seek the help of your doctor. Now, finally, to wrap this up, when we talk about morning sickness, as I mentioned earlier, is not something to be worried about. However, a very severe form of morning sickness known as hyperemesis gravidarum is something that you really need to seek the help of a medical professional. What does this mean? Hyperemesis gravidarum means when your morning sickness is severe, you're vomiting a lot, you can't keep food or drink down. The moment you eat, you vomit it out, and the moment you try to drink anything, you also vomit it. This can lead to electrolyte imbalance. It can lead to severe weight loss. More than 5% of your body weight is lost, and it can make you to be really, really dehydrated and very, very weak. So if you're experiencing these symptoms, at this point, you must get to the hospital, because you will need some kind of intravenous replacement of fluids just to help manage these symptoms. So if you experience any of these and you're not able to manage it at home, please seek the help of a healthcare professional. So if you enjoyed this video or found it helpful in any way, please do not forget to give me a like and subscribe to my channel, because here we share helpful tips on fertility, women's health, and everything health. Also, do not forget to ask your questions in the comment section. Leave any comments you would like me to talk about in the next video. Thank you for watching, and I'll see you in my next video. Bye for now.